Hello everyone, I am Dr. Ziyad. Welcome to the aapc CPC mock exam 2. In this mock exam, we will go through all 100 multiple choice questions organized by chapter, just like the real CPC exam. I will explain you how to find the answers easily and quickly. So make sure to subscribe my channel and check out my playlist. Mock exam 2, chapter 7, CPT 10,000 series questions. There are 6 questions. Question number 1. A 30-year-old patient undergoes a procedure for a scalp defect where a physician surgically inserts a tissue expander. The operation also includes the initial filling and subsequent expansions with saline solution to stretch the tissue for the final reconstruction. Which CPT code accurately reports the procedure? So there are 4 CPT codes available. Take your CPT code book and find the answer. So here you have to highlight this is an insertion of tissue expander, initial filling and subsequent expansion with saline solution. So to stretch the tissue for final reconstruction. These are the main terms you have to highlight. When you look at the answer, you can see A and B are the adjacent codes and other 2 codes are deviated codes. So you can use both ways to find the answer. What first method is elimination. You can directly go to the code and find the answer, or else you can use the CPT alphabetic index and find the answer. First, I'll tell you how to find the answer using elimination method. So first go to the code. First code 11,960. It says insertion of tissue expander for other than breast, including subsequent expansion. So this is exactly mentioned our procedure, that is the expander inserted and subsequent expansion. You can see expander inserted and the subsequent expansion other than breast. So here the procedure done on the scalp, so other than breast. So this code is more suitable for the answer. Let's check other answers as well. 970 is replacement of tissue expander with permanent implant. That is not the condition here. And the code C, that is 15,777 is implantation of biologic implant. That is not the condition here. 19,357 is tissue expander placement in breast reconstruction, including subsequent expansion. This is the condition here, but this is not done in the breast. This is done in the scalp. So the correct answer should be answer A, that is 11,960. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the main procedure, that is expander. So go to expander, it says skin inflatable. On the down it says C, tissue expander. So again you have to go to search for the tissue expander. So once you go to the tissue, again go to the subcategory of expander, then go to the subcategory of insertion, then skin. It will lead you to the code 11,960. Again go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer A. Question number 2. A 50-year-old woman is evaluated for 2 new hypoechoic masses in her left breast. In the outpatient radiology suite, an interventional radiologist performs fine needle aspiration biopsies on both lesions using continuous ultrasound guidance. First, a fine needle is inserted into the 1.6 cm lesion to obtain multiple cytologic samples. The physician then redirects the same needle to sample the second 1.1 cm lesion to obtain additional specimens. Which 2 CPT codes correctly report these procedures? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is fine needle aspiration biopsy on 2 lesions using the continuous ultrasound guidance. First lesion is done, that is 1.6 cm. The same needle used for the second lesion, that is 1.1 cm. Both are done using the ultrasound guidance. So when you look at the answer, you can see adjacent codes are used. A, B and C are all adjacent codes and D is somewhat different code. So you can use elimination method or the CPT alphabetic index. So let's use the elimination method first. So the code 10,021 is fine needle aspiration biopsy without imaging guidance. But in our case, we have used the ultrasound guidance. So this is not possible. Next answer 10,005, that is fine needle aspiration biopsy including ultrasound guidance first lesion. So this is suitable. Plus the second code 10,006, that is each additional lesion. So there are 2 lesions we have used, both are done using ultrasound guidance. So 10,005 and 10,006 are the correct answers. So you can directly go for the answer C. If we check other codes, like 76,942 is ultrasonic guidance for the needle placement. So here this is not the needle placement, this is the fine needle aspiration biopsy. And if you go to 19,000, that is puncture aspiration of sister breast. But our one is fine needle aspiration, not the puncture aspiration. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So in the CPT alphabetic index, directly you have to go to the term fine needle aspiration biopsy. So there's the index called fine needle aspiration biopsy, subcategory lesion. So there are multiple options available. So here CT guidance, fluoroscopic, MRI with ultrasound guidance. So our case is with ultrasound guidance. So it redirects you to the following two codes, 10,005 and 10,006. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 3. A 57-year-old woman presents to the office with 5 painful hyperkeratotic calluses on her hands. In a single visit, the physician soaks both hands, then pares and removes all 5 calluses using a scalpel until only healthy tissue remains. Which CPT code correctly reports the treatment of these lesions? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is hyperkeratotic callus on her hand, pares and removes all 5 calluses using a scalpel. So when you look at the answer, all codes are adjacent codes. A, B, C and C are very nearby codes and D deviated code. So you can use the elimination method to find the answer. Also, I will explain the alphabetic index method also. So when you go to the codes, 11,055, that is paring or cutting of benign hyperkeratotic lesion, single lesion. In our case, it is 5 calluses. So 56 is 2 to 4 lesions. 57 is more than 4 lesions. So in our case, this is 5 lesions. So that is more than 4. So the correct answer will be 11,057. So correct. The C is the correct answer. When you look at the answer D, that is shaving of epidermal or dermal lesion. So this is not the shaping, this is parsing. So the correct answer is answer C. So if you use the alphabetic index, directly go to the index of paring. Again, go to the subcategory of skin lesion. There you have to go to the subcategory of benign hyperkeratotic. It will lead you to the code series of 11,055 to 57. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 4. A 30-year-old male presents with a small raised lesion on his right forearm that has been present for approximately 6 months. The lesion is not painful, stable in size, and measures 0.5 centimeter in diameter. The patient works outdoors and has significant sun exposure. The dermatologist suspects the lesion is benign but decides to excise it for cosmetic lesions and further examination. Which CPT code correctly reports the removal of this lesion? So there are 4 codes available. Take your CPT code book and find the answer. So in this case, we have to highlight this is the lesion on the right forearm, 0.5 centimeter in diameter. The dermatologist suspects the lesion as benign and decides to excise for cosmetic lesions and for further examination. When you look at the answer, all codes are adjacent codes. So you can use the elimination method to find the answer. Also, I will explain how to find the answer using alphabetic index. So first go to the code 11,305, that is shaving of epidermal or dermal lesion. In our case, this is excision, not shaving. So this answer is not possible. 11,400, that is excision, benign lesion including margins except skin tag, trunk, arms, legs, excise diameter 0.5 centimeter or less. In our case, it is 0.5 centimeter, excision, and the lesion on the right forearm, so arms. So all the conditions are fulfilled by this code, that is 11,400. So correct answer will be answer B. When you check other codes, 11,055, that is paring or cutting. That is not the case here. 11,600 is excision of malignant lesion. Here we are suspecting this is as the benign lesion. So the correct answer will be answer B. So if you are encounter this case in a real working scenario, you have to use the CPT alphabetic index. When you go to the CPT alphabetic index, first you have to go to the term excision, then go to the subterm lesion, then go to skin, then go to the subcategory of benign. It will lead you to the following code series. Again, you have to go back to the tabular list and we have to start searching from 11,400 to other codes. So when you search, the correct answer will be answer B. Question number 5. A 5-year-old is brought to the emergency department to repair 2 lacerations, a 3 centimeter laceration on her right arm and a 2 centimeter laceration on her nose. Her arm is repaired with a single 1-layer closure with sutures. Her nose is repaired with a simple repair using tissue adhesive, that is 2-cyanoacrylate. How are the repairs reported? So there are 4 answers available. Take you a CPT code book and find the answer. Here you have to highlight there are 2 lacerations. First one is 3 centimeter laceration on her right arm and 2 centimeter laceration on her nose. Arm 1 is repaired with the simple layer closure, that is suture, and the nose one is repaired with the simple repair using tissue adhesive. So when you look at the answer, all codes are adjacent codes, 12,011, 32, 2. So you can use the elimination method to find the answer. So directly go to the code. So when you look at the code 12,011, that is simple repair of superficial wounds of face, ears, eyelids, nose, lips, or mucous membrane. Both lacerations are repaired with a simple repair because first one is simple layer closure, second one is tissue adhesive. So both are simple repair. So 12,011 is simple repair of superficial wounds of face, ears, eyelids, nose, lips. So nose one included here. So the second one, her nose is repaired with a simple repair. The nose, the laceration in the nose is 2 centimeters. So here is 2.5 centimeter or less. So for nose, you can use this code 12,011. When you look at other code 12,031, that is repair intermediate. But our two lacerations are simple, not the intermediate. So you can use this code. So 32 also not possible. 12,041 also repair intermediate. So that also not possible. 12,001, that is simple repair of superficial wounds of scalp, nail, neck, axilla, external genitalia, trunk, or extremities, including hands and feet, 2.5 centimeter or less. In our case, the hand laceration, the right arm laceration is 3 centimeter. So 2.5 or less, you can use the 12,001. So it is more than 2.5, you can use the 12,002. That is 2.5, 2.6 into 7.5 centimeter. In our case, the hand laceration is 3 centimeter. So you had used this code as well. So the correct answer will be 12,002 and 12,011. That is for the nose one. The modifier 59 is used as this is the distinct separate procedure because both are simple repair, but one is done on the nose and other one is done on the hand. So the correct answer will be answer D. If you encounter this case in a real working scenario, you had to use the CPT alphabetic index. When you go to the CPT alphabetic index, for the laceration one, that is on the right arm, 3 centimeter one, you have to go to the term repair, then go to the subterm wound, then go to the subterm simple, that is simple repair. So this is the order: repair, wound, then simple. It will lead you to the following code series 12,001 to 12,021. Again, go back to the tabular list and confirm the answer. Similarly, laceration 2 also, same way you have to follow: repair, wound, symbol, again the same code series. Once you confirm with the tabular list, the correct answer will be answer D. Some people might say answer C because the second simple repair that using the tissue adhesive may not be billed. Yes, some payers are not billed for this repair using tissue adhesive, but CPT coding you had to use the code, but for the billing purpose only they may accept or may not accept. But the CPT coding you had to code for both procedures. Question number 6. A 35-year-old female has cancer in her left breast. The surgeon performs a mastectomy, removing the breast tissue, skin, pectoral muscles, and surrounding tissue, including the axillary and internal mammary lymph nodes. Which CPT code is reported? So there are 4 CPT codes available, all are adjacent codes. Take your CPT code book and find the answer. So here you have to highlight this is mastectomy, and the removing the breast tissue, skin, pectoral muscles, and surrounding tissue, including the axillary and internal mammary lymph node. So when it comes to the mastectomy, there are several types available. For example, simple, modified, radical, modified radical. So there are several types depend on the tissue layers removed. So you have to be careful when you're going for the answer. So when you look at the answer, all answers are very adjacent, 303, 5, 6, and 7. So you can use the elimination method easily to save your time. So when you go to the answer, 19,303 is mastectomy, simple, complete. But this can't be the answer because it is not mentioned the other parts. So when you go to the other answer, 305 is mastectomy, radical, including pectoral muscle, axillary lymph node. So this is almost matching the procedure, but this internal mammary lymph nodes part is missing. When you look at the other answer, 19,306 is mastectomy, radical, including pectoral muscle, axillary, and internal mammary nodes. So this is exactly matching the procedure here. Removing breast tissue, skin, pectoral muscles, and surrounding tissue, including axillary and internal mammary lymph. If you look at the other answer, 19,307 is mastectomy, modified radical, including axillary lymph nodes with or without pectoralis minor muscle, but excluding pectoralis major. But here it includes the pectoral muscles. So this code also not possible. So the correct answer will be 19,306. So that is answer C. So when you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So you can directly go to the index of mastectomy. So when you go to the mastectomy, you will get following, you will get all category of mastectomy types. So here you can see modified radical, partial radical, simple. So when you are not sure which category this procedures belongs to, you can go to any code and you can read other code description as well. So you can start with the 302, 3, 4, 5, 7. So when you read the description, you will find that correct answer will be answer C. This is the end of mock exam 2 CPT 10,000 series questions. If you have any doubts, please leave in the comment. If you have any questions, you can email me or WhatsApp me the numbers provided in the description. If you feel this channel is useful, please subscribe my channel and share with other friends as well. Thank you very much.